Okay, so in this video, we're going to explain assessments. So all the assessments are found under the assessment tab in the clinical chart. So if you just come and click here, you now have all of your assessments. So you have this new button, so you can come here to create a new assessment. You can also come here to filter by type of assessment. So if we're going to weekly skin assessments, we can click here and it'll just pull up all of the weekly skin assessments historically. Sometimes residents have been admitted long enough that you can scroll all the way to the bottom and there will still be more weekly skin assessments or another assessment. So you can come here and click this view all, and that'll just open up even more assessments. So this video is going to cover all of the nursing assessments. There's a lot more assessments in PCC done by different departments. And so that's something that we'll just go over all the nursing clinical part of the assessments. So an important thing that you may see here is this copy function under assessments. What this does is it just allows you to copy any assessments over. For example, if you're doing a weekly skin assessment, you're able to just push copy. It'll pull up this window here. You'll just click, we're doing a full assessment, pretend it's just a weekly, and then we'll save it. And you'll notice it'll pop up a new weekly skin assessment. What will happen here is then you'll have to go edit and clean it up that way. So we will dive into assessments and start just from alphabetical order, and we'll go over all the tips and tricks associated with those. So one of the first ones you're going to see is the admission nursing assessment. These are all the assessments in PCC for our module, but all you'll have to focus on right now is the clinical again. So we have the admission nursing assessment. Save that. You'll see it'll open up a new assessment. This assessment is for any new admits, and you'll just want to make sure we go over every single one of these tabs and make sure it's signed. So I'll show you what it looks like. You'll click edit. You'll come here and you'll start filling these tabs out. Now you can click save and exit, which will save your progress, and you'll see that it's red here. So that just means that there are still items that need to be addressed. Come here down to this next one. You can click save and next, and that'll just pop you over to the next one. You'll see, let me show you here. Pretend we've gone all the way down, and I'll say yes. Save and exit. You'll see that it then turns yellow and says sign. So now I'm able to sign for this assessment. This portion of this assessment, you'll see that it turns green. So once all of these are green, then you know you're good to go. You'll see the error pop up, and it'll tell you where responses are required. So 1A1, click that. So section 1A1. And in this case, it's just going to go over every single one. When you have errors, you can come click this view errors and then go all the way here. And oftentimes you can check all. I'll show you what that looks like on our weekly skin assessment. So that's the admission nursing assessment. We'll just get back here. So something important to notice and to never do with your assessments is to delete them or close them. You guys won't have the option to delete, but the close function. If you close it, what it'll do is it'll do this. You see how it says incomplete? What'll happen is it'll stay in their chart for forever, basically, and you'll just be stuck with these options. If you just notify your director of nursing or the IT desk by submitting a help desk ticket, they're able to go delete the assessment so they actually disappear from the chart. So talking about the errors, we'll come here and click this. You'll see that once I save it, you'll see that there are errors. So once I've copied the assessment forward, you then notice there's these check marks. What you can do is click the check mark and it'll go away. That basically what it's asking you to do is just review the assessment. Just make sure all the information is accurate. But what you can do is come here and click view errors, and what it'll do is on long assessments, you'll have a bunch of these. You can just check all of them and then save. What that'll do is take away all the check marks. And then once you're good there, then you can just save, sign, lock, and exit. So we'll just go to the next assessment down the line, which is the alert charting. So alert charting is going to be done anytime you have any sort of incident. So if you have a fall, if you have an elopement, a smoking injury, a resident-to-resident encounter. So it's kind of got the list here. And this will always be done in conjunction with a risk management. So you fill out the risk management. We'll go into that in another video. And that risk management, that whole charting segment will then prompt you to create a alert charting assessment. So you'll just come down here, fill out all of these sections, update vitals, view all, and if there's more new ones, you can click and choose those ones. It will auto-populate if you put the vitals in beforehand. And then you'll just click and type a little description for the shift. So it's important to note that when you're doing a alert charting assessment, let's just pretend it's a fall. We'll say, yes, injury did occur. Then you will choose the type of injury. We'll say there was an abrasion. So to the elbow. And orders are to cleanse and cover with Band-Aid. Now, when you put that order in, you want to also make sure that you put an order in PCC and the orders tab. So you just have to look to the other video to see how to do that, or if you're comfortable just putting in those orders, follow through with that. Otherwise, it won't get charted on. Then you'll come here to this care plan. They have actual skin impairment. The goal is that this injury will be healed by the review date. You'll just come here and click edit and fix these. So you'll specify the skin injury, right elbow. I don't think I included right up above. Here we go, right elbow. And then obviously we're going to follow facility protocols, encourage good nutrition, avoid scratching. So some of these goals that we're going to do. So now that I've filled out this assessment, I'm going to come down here, save and next. And then you have this section. Has the resident fallen before? Yes, you'll make sure you fill this out accordingly. So every time there's a fall or any sort of incident, the first person to, if the fall were to happen on your shift, you would want to make sure you fill out these first two bars of the assessment. And then the next shift and the following shifts will then fill out these. Sometimes what I notice is when there's an incident report or people are doing alert charting follow-up shifts, they'll go and create a brand new alert charting assessment. That's not necessary with alert charting. All you have to do is just come here and find the alert charting. You may have to sort it here. Come to the correct one, click edit, and then click your appropriate follow-up shift. So I will do a fall. Yes, injury did occur. It was an abrasion. Right elbow. You just have to make sure you're doing this accurately. Sometimes it is helpful to go back to the very first assessment and see what happened. And then you can just say healing or skin closed, or you can say scabbed, anything, whatever is appropriate. This section is asking, is it appropriate to give the responsible party an update this shift? So unless there's a significant change, that's usually not necessary. Vitals will update as long as you have that in accurately. And then you just fill this out. And then you'll want to save, sign, and next. The end. The very end is the fall review, which will be completed by either your ADON or your DON. So just make sure to leave that blank. There you go. I'm just going to delete that one. Okay. Next down the line is the infection or antibiotic daily monitoring. Right here. This assessment is done anytime there's an infection. So if somebody is on antibiotics, we will just track every day to see how those antibiotics are doing. So pretend we've got a urinary infection, they've got a catheter, and they're on a certain medication for it. So you would come here, the medication that they're on that would be ordered, pretend it's amoxicillin or Rocephin or whatever it be. You would just click that here, and it would select and auto-populate in this area. You would then click other treatments that you're doing, maybe pushing fluids, Tylenol, any symptoms from the UTI, and any adverse drug reactions. It's a very quick assessment, but this has to be done every single shift while they're on an antibiotic and 3 days after. So it's very important that we're monitoring during the antibiotic. The one that will accompany this assessment, so anytime you put somebody on an antibiotic, you have to do an initial infection report. So you'll come here, initial infection report, save. And this will just walk you through all the steps of your infection. So was the infection present on admission or 3 days after? So let's pretend it developed in-house. No. So where did this develop? We'll just say here. Date of onset of symptoms. We'll say they started yesterday. And we can pretend it's urinary, no catheter. So the cool thing about this one is it will then ask you Meagher's criteria. And it's cool because it'll change. So you can see you have to have one of the following. Skin and wound. You have to have 4 of the following. Eye. You have to have 1 of the following. So it's very helpful when you're doing this to make sure that you did meet Meagher's criteria of the infection. Oftentimes in skilled nursing, we are treating infections. We're treating things that actually are not legitimate infections. So then you'll just come here and you'll say, yes, they have fever and chills. They have new burning, and they have change in character. So we have at least 3 there. You'll update your care plan. So they have a UTI. We hope that it will resolve fluid and antibiotic therapy. Just come here next. This will ask you about your labs that you've done. So the practitioner was notified. Let's pretend we contacted David Workman, let them know today at 1 o'clock, resident representative. And we'll say it's Jimmy Test. And we notified them today as well. About the same time. They're not on hospice or they're not on hospice. Did we order any labs? Yes. So we obtained the labs today. And we got the results. E. coli. We did not order any diagnostics. If we did, that was like ultrasound, or if any cultures were ordered. In this case, we could say yes. So we obtained the type of transmission precautions. So you can select that there. And then was treatment started? Yes. And then you can see the assessment it kind of adapts to what you choose. So if treatment was started, yes. Does the infection meet Meagher criteria? No, it'll ask you why. Yes, you're clear. And then you just come here and select the medication you're on. Select the start date, stop date, and the provider. And that's it. If you add any other medications, you just follow suit. So it's important when somebody has an infection and you start antibiotics that you do the initial infection as well as the infection antibiotic daily monitoring. So for this initial infection report, you only have to do the first 2 bars because it obviously hasn't resolved on day 1. So this will be your infection preventionist that will come through at the end and figure out the resolution. The next one is very similar to the admission nursing assessment, which is the readmission nursing assessment. This one is a lot faster than the admission nursing assessment. It doesn't have the baseline. This is just helpful for when somebody's coming back from the hospital. So if they're already an established patient, they go to the hospital for 4 days for pneumonia or respiratory failure or whatever it is. Then they come back, you'll do a readmission nursing assessment. Okay, the next one we have is the skilled nursing notes right here. So you may notice you get skilled nursing notes. This is for anybody who's on a Med A stay or is getting therapy, as well as anybody who's recently admitted. We usually do that for the first 5 days upon admission. And the last reason we do it is anybody that's on their MDS look back period. So this just goes over every single, it's very similar to the admission nursing assessment. It goes over a lot of the body systems. So you'll go over cognition, and it just wants you to go through all of these: mood, behavior, cardiovascular, respiratory, ADLs, GI, skin and wound, pain, any new orders, any skilled services that they're on, and then a note. This one is very helpful to copy forward. As you can see, there's a lot of information on here. Most of it doesn't change, but you want to make sure that you do check every single thing. This is one that you may notice a lot of the check marks on. Let me go see if I can find one, if we have a skilled. Okay, so we'll come here to this skilled nursing. Sorry, not that one. This one that's complete. We'll copy forward. Let me show you what it looks like to have all those check marks and errors. So you'll come here, edit. This is the one I've copied. And now you'll see, look at all these check marks. There are so many of these check marks everywhere. So instead of just coming through and looking at every single one of these and clicking through, making sure it's accurate, what you can do is save. Then this will come up with errors. You view your errors, scroll all the way down to the bottom, check all, save. Now all those check marks are gone. So you'll just want to make sure you still go through every single one of those, but that just saves you the hassle of going through and clicking every single one of those check marks. Come through here, make sure all of this information is accurate, and then you will save, sign, lock, and exit. What will happen is it says, hey, it's creating a progress note. You say, that's fine. Cool, there you go. So that is your skilled nursing notes. All of these assessments really, in reality, shouldn't take too long. The longest one is going to be your admission nursing assessment, then your readmission, and then your skilled nursing notes. As long as you're copying this skilled nursing note and just going through and making sure it's accurate, after you've done your assessment of the resident, it shouldn't take any longer than 5 to 10 minutes maximum. The very last assessment I wanted to show is down here. You do this weekly skin assessment. So it's probably the quickest assessment, but something you want to make sure you do very accurately. So we check the resident's skin once a week. We in our building have it lined up with the shower days. So you'll just want to make sure that when they go into the shower, you just go check on their skin with the aid and see if there's any skin breakdown that you can see. As long as the skin is intact, and you'll just want to look at their mouth and their dental status. And we can say, yep, we have none of the above. And you're good. Save, sign, lock, and exit. If they do have skin breakdown, you'll come here and you'll select where. So you'll come here and say, okay, let's pretend they have it on the back of the head. So 5. And you can say abrasion from fall. Healing and is now a scab. Pretend we can, that's probably not the best note you could write, but you get the gist where you'll want to just describe. You don't want to start calling things pressure sores or anything like that. If there is a redness, if there's any redness anywhere, you want to make sure that you note if it's blanchable or not. That's a very distinguishing factor. If you just put redness, that can mean a lot of things. So you want to say blanchable. Some little tips and tricks there. If they have a diagnosed wound that is being treated and it is classified, you're more than welcome to call it what it is. Let's just say they're good. Save, sign, lock, and exit. Some other assessments that you may see would be some of these that the MDS nurse would do. You might see a dietary profile from the dietitian. You may see an entrapment assessment, this interdisciplinary care conference and discharge summary. These are things you'll see when somebody discharges. The nurse will just go sign out here, or in our case, it'll be the DON or ADON. And then the interdisciplinary care conference. This is an assessment we use when we're meeting with families. The Morse Fall scale, often done every quarter. A nutritional assessment done by the dietitian. Psychotropic review. This happens once a month. If you are ever interested, you can go see the psychotropic notes that were taken and the decisions that were made and all of the medications that were reviewed. The quarterly assessments. This includes a bunch of things like the Fall scale, looking at the skin assessment, and the Braden scale. Go down here, respiratory screens, skilled COVID. We're so glad these aren't as prevalent anymore. We don't have to focus on these right now. The skin and weight review is a weekly meeting that the ADON and dietary manager and the DON will go over with each other, where they just go over every single resident in the building that is triggering for weight loss or weight gain. If they have skin breakdown, if they're below 100 pounds, there's certain criteria, and they just take a deep dive into their chart, their orders, and just kind of make sure that everything is working out for them, for their weight and their skin. And then the weekly wound eval. This is completed by the wound nurse, and it is a detailed summary of the wounds that resident has, and as well as the treatments for those wounds. So if you're ever interested to see what we're doing and how it's staged and what the wound nurse has done, you're welcome to pull up this assessment and go through it. And it can be very helpful, really supplementary to your nursing practice.